This medication is specifically designed to help manage knee pain in individuals who have osteoarthritis. Zilretta suspension extended-release vial works by decreasing the immune response in the body, ultimately reducing pain and swelling in the knee. It contains Triamcinolone, which is a type of corticosteroid that is effective in managing arthritis-related discomfort. It is important to use this medication as directed by your healthcare provider, and they will determine the appropriate dosage and timing for your specific needs. The Zilretta suspension, extended-release vial is administered through an injection into the affected knee by a healthcare professional. It is essential to consult with your doctor regarding the activities that are safe for your knee after the injection. Additionally, it is important to inform your doctor if your condition persists or worsens. Some common side effects of Zilretta suspension, extended-release vial may include pain at the injection site, increased blood pressure, elevated blood sugar levels, and decreased ability to fight infections. If you experience any of these symptoms, it's important to consult your doctor. Additionally, be on the lookout for more serious side effects such as weakness, unusual weight gain, vision problems, and signs of stomach or intestinal bleeding. In rare cases, a serious allergic reaction may occur, so seek medical help if you notice any symptoms of an allergic reaction. Remember to contact your doctor or pharmacist if you experience any other effects not mentioned here. Before using Zilretta suspension, extended-release vial, make sure to inform your doctor or pharmacist about any allergies you may have. It's also important to discuss your medical history with your healthcare provider, especially if you have any existing conditions such as diabetes, heart problems, high blood pressure, or infections. Long-term use of this medication can make it harder for your body to respond to physical stress, so be sure to inform any medical professionals about your medication usage if you need surgery or emergency treatment. It's important to limit alcohol consumption while using Zilretta as it may increase the risk of stomach bleeding. This medication may also mask signs of infection, so be cautious around people with contagious illnesses and consult your doctor if you have been exposed to an infection. Inform your healthcare professional before undergoing any immunizations, vaccinations, or skin tests while using Zilretta, and avoid contact with individuals who have recently received live vaccines. Older adults may be more sensitive to the side effects of Zilretta, and long-term use of the medication in children may slow down their growth. If you are pregnant or breastfeeding, consult with your doctor before using Zilretta to ensure the safety of the medication for you and your baby. It's important to be aware of potential drug interactions with Zilretta suspension, extended-release vial. Some products that may interact with this drug include aldesleukin, mifepristone, and other drugs that can cause bleeding or bruising. Aspirin can also increase the risk of bleeding when used with this medication, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. It's also important to note that this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are using Zilretta suspension, extended-release vial. If someone has taken too much Zilretta suspension, extended-release vial and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. It's crucial to act quickly in such situations to ensure the person receives the necessary medical attention. It's important not to share this medication with others as it is prescribed specifically for you. When used for a long time, Zilretta suspension, extended-release vial may cause bone problems such as osteoporosis. To help reduce the risk of bone problems, it's recommended to make lifestyle changes like engaging in weight-bearing exercise, getting enough calcium and vitamin D, quitting smoking, and limiting alcohol intake. Discuss with your doctor about any lifestyle changes that may benefit you. Zilretta is used to treat osteoarthritis pain in the knee. It is given as a single intra-articular injection into the knee joint. The recommended dose is 32 mg. The injection is given by a healthcare professional. This medication, Zilretta suspension, extended-release vial, is only administered in a doctor's office and will not be kept at home. It is used to provide pain relief for osteoarthritis of the knee. The typical dosage is 32 mg injected into the knee joint once. It is recommended to take this medication at the optimal timing recommended by your doctor. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.